we need to build trust in the data itself, that people recognize it's credible, and at the same time promote data literacy. And literacy is a word that we can interpret in different ways, but if it's not understandable, if you can't take that data that comes back from the lab or your doctor's note or whatever, we need to make sure people can understand that and take action on it. So that's quite easier said than done, but there's a lot of energy being devoted to how do we do a better job of that, and not just by CIHI, I think it's system-wide. So I think the last thing I'd say is, when we look around the world's best health systems are powered by data. And we also know that patients bring a very unique insight that better helps us to understand that data. Their lived experience helps to explain our findings. And quite frankly, it ensures that our work remains relevant to the decision makers who often work without having patient voices in their ears. And so I think it's an important influence that we want to nurture and cultivate. So one of the things that came out of this Pan-Canadian Health Data Strategy was a recognition that CIHI needs to do more, and so we were given extra money from the federal government to begin to move forward on several large modernization initiatives. We've been around for 30 years. We've been doing all kinds of really important work to strengthen the caliber of the data in our publicly funded health system. But the challenge post-COVID was we've got to do better. We need to move faster, and my colleagues and I are feverishly working on a transformation plan. Actually, we have our CIHI board meetings tomorrow in Ottawa, and we'll be presenting to them these initiatives that I'll briefly touch on for your benefit. I won't get into all the details unless there's questions. Happy to dive deeper then. But we see ourselves, we're a health data organization, but we're actually a health organization, period. We just tend to focus on data. And we see our mandate as helping improve quality of care by providing better data. It's as simple as that, and it's as complicated as that. And we really have made a concerted commitment to making patients the central focus of our work. We've been developing those focuses or foci over the last few years, but it's become even much more important to us as we go forward. So this is just a picture of some of the things we're working on. I'll start at the top and just quickly around. So connected. A health data ecosystem that's connected. For those of you who have experience, you'll recognize that your data doesn't follow you very easily. And if those of you with serious chronic conditions or other diseases, you often hear stories of people carrying binders of their medical information so that stuff doesn't get missed. And so the idea here is that if we adopt data standards, and that's the term we use, it's just a consistent definition of what something means that we all agree on, and we all agree we're going to report it and measure it the same way. It's not as prevalent as we would hope. We're focused on that. Creating that common language, it makes it easier to share the data without having to sling a binder along with you. That's what that's all about. We work very closely with one of our sister Pan-Can health organizations, Canada Health Infoway, on a whole program of work called Connected Care. We're producing the data content framework. Where is Natasha? So we're very intrigued, as Paul's questions would have alluded to, about the social determinants of health, the survey material, I'm getting the phrasing wrong, excuse me, but accessing that type of data to enable social prescribing or whatever we come to call those services. That should be part and parcel of our framework. It's not just acute care or primary care, as important as those are. So I was really intrigued by that as well. So the next one is all about accessibility, and it's, for those of you who do know CIHI and you've tried to navigate our website, before I joined CIHI, I used to do the same thing. I still do a little bit, but it's Byzantine. It's very hard to find what I need when I need it. So we're really investing a lot of resources to make it more intuitive, that you shouldn't have to be an epidemiologist to read a report or an analysis or something that speaks about wait times for surgery in different provinces or whatever the case might be. I've touched on data literacy a little bit, but to me that's at the heart of, we need to do a better job making that data easily accessible and understood, and that's all part and parcel. And it's not just for patients and patient advisors, like politicians, policymakers. A lot of people are not that data literate, quite frankly, and that's not a criticism, it's just a reality. If it's not your thing, it's not your thing. So it's incumbent on us, those of us who work with data, to make it easier to understand, digest, and take action with it. Comprehensiveness is another thread to this, and this is really There are so many diverse data sources, and just knowing what happened in a hospital without knowing what your community family physician or nurse practitioner is doing versus what your counselor might be doing, if those are not linked and able to follow you throughout your journey, it's not very valuable, or it's not as valuable as it could be. Timeliness was the big COVID driver for us. We've been collecting data for years, but it tends to be quite old. There's a lag just because of how the data gets collected. With the wonderful advances in technology and things like application programming interfaces, if you really want to know, I'll explain what that is. But there's a lot of ways to get the data faster and eliminate a lot of the manual coding that a lot of healthcare organizations subject themselves to get it. Good news is we think we can speed up the data so that rather than telling you what happened 6 months ago, we can tell you what happened last week, and within organizations even on an hourly basis. Relevance matters. Data is great, but if it doesn't have the context, it's not very helpful, is it? And so that's another area we're working on, making it more contextualized, telling the stories that the data reveals to us, and not just us telling those stories, but helping people to be able to tell their own stories. And then lastly, perhaps, is that it must be trustworthy and trusted, which means we have to develop this in a way that people feel that it's been done with integrity and respecting privacy. Those are sort of fundamentals for CIHI. So I've talked a little bit about the Pan-Canadian Health Data Content Framework. I will resist going more into that unless there's interest. I know some of you are participating or engaging on that, and we welcome that. And some of my colleagues will be sticking around for the remainder of the event, happy to talk more. So let's talk a little bit more about how we are working with patients and families. And I'll preface this by, see patients as in quotes. It's not just patients, it's clients, it's residents, it's family members, it's caregivers with lived and living experiences that we want to engage with. We've been cultivating this skill or this ability for the last few years, but we really want to bring the patient voice even more into our work. We see it as foundational, actually. And there's growing evidence that patient involvement really helps with health research. And so you'll see we see patients as representatives, as advisors, as partners, and as leaders. And I won't go through those. I'm happy to give examples if there's interest, but whatever role we ask for, we want people's engagement to be meaningful, purposeful, and authentic. All contributions like these, they really do influence our decision-making, and I'll share a story with you in a second that's quite on point to demonstrate the power of patient voice to our work. It's not just ticking boxes, as somebody joked about at the break. So here's some headlines. The impacts of patient partnership are on full display if you read the papers or follow media coverage. There's a ton of work that we're reporting on that helps communicate to the public in a meaningful way. We see patient partnership as integral in helping us tell those stories. We've just recently released a report on what we're calling the common indicators that help paint a picture of primary care across the nation. And you'll see these report by province and territory what it's like, how many people have access to primary health care, for example, or how are we doing on improving the supply of physicians and nurses, or reducing wait times for surgeries, access to mental health and substance use services. What are we doing to modernize our healthcare information systems? How many physicians are able to share data readily with another physician in your circle of care? So we're tracking and publishing that, and it's sparking a fair bit of interest. But what we've really learned, and I feel like I'm repeating it, but I think it merits repetition, is patients have been instrumental in the development of this work. And it's really helped drive the importance of this reporting to people who don't necessarily take it personally. So the story I want to share with you, and this goes back a few years, so for those of you who are a little older like me, you may recall when Paul Martin was Prime Minister, and he announced a big, I think it was $10 billion fix for a generation for healthcare. And as part of that, what the feds wanted in exchange was that provinces would agree to report on what we call the shared health priorities. And so this is almost 10 years ago, I believe. And so Health Canada, wanting to drive that process, called their PT partners together. So you can imagine you've got 14 officials from every government in the country in a room, and then we're going to argue about, well, how do we measure wait time for surgery? And it turns into a big intellectual debate, and if you work in government, you'll know all about the FBT bun fight, as I call it. There's a lot of adversarial tension. It's just the nature of intergovernmental affairs. And so Health Canada labored mightily at this, couldn't get anywhere. It just was a long intellectual debate. So then they turned to CIHI and said, can you guys take a shot at this? So we did, and we entered that room. First thing we did was we brought in people with lived experience. We also brought in subject matter experts on how do you measure access to mental health and substance use. We brought patients or people who had personal experience with this. And it was, it was quite amazing to see how the conversation shifted when you had people talking about, I can't get my kid in for counseling. And, sorry. But it was quite revealing to see how, even the coldest-hearted bureaucrat couldn't ignore that. And that really unlocked the conversation and allowed us to get to meaningful agreement on how do we report on this. It really knocked down a lot of the turf and the BS, which I was quite pleased to see. So it really impacted the process, and everybody has a health story, is what I like to say. And that humanized it. So I thought that was worth sharing. I thought you were going to bring me a tissue. I want to talk a little bit more about CIHI's commitment to equity and Indigenous health priorities. How are we doing for time? Good? Okay. So CIHI's data is rooted in the pursuit of health equity. And we've heard lots of conversation in the opening session, and I know the panel that follows me will speak to this as well. But we've developed a lot of guidance on equity stratifiers, whether that's demographic characteristics like age and gender, income level, race, Indigenous identity, of course, that can help identify those population subgroups. And once we have those in place, you can drill down into the data, and you can really identify and report on some of those potential inequities and inequalities that exist between the subpopulations and measure those differences in health and healthcare. And that allows us to tackle them in a more thoughtful, responsible way. I would note we've developed a toolkit to help us onboard patient partners when they join us and participate in projects and provide guidance to support their physical, mental, and financial well-being. We recognize that talking about one's healthcare experience or the experience of someone you might represent can be tough. We also acknowledge that when you give your time, we're taking you away from other things, your job or your otherwise busy schedule. So we want to do that very respectfully. So we've put a lot of thought in these guidelines for supporting patients, and look forward to sharing them with you if you haven't had an opportunity to see them. We're also developing what we call an engagement framework on how to better involve Indigenous peoples and communities as patient partners. And I would note we already have several active engagements in flight, but we want to do an even better job of that. So with regards to working with Indigenous partners, we really want to better understand and respond to their health information and data governance needs as they define them. And that's really important to emphasize. Again, nothing about us without us. We have lots of ideas, but it's not really our decision, quite frankly. So forming those partnerships that engage people locally, regionally, and nationally is one of the things we're turning our minds to. In particular, working on respectful governance of Indigenous peoples' data as well. So we're very mindful of data sovereignty principles, particularly as they relate to First Nations, Inuit, and Métis communities. I will highlight one piece of work we're very proud of. We're developing cultural safety indicators, which really was sparked by the Joyce Echaquan incident and the fallout from that, and that we got endorsement from ministers across the country to advance work on that. It took time, but I'm pleased to report that we have a table of 8 strong, wise Indigenous women who have driven a process that allowed us to begin to point to things we can actually measure that can report on at a facility level cultural safety. And so that's something that can be fixed. And so as we report on the other things like access and wait times, as one of my colleagues said, well, this is kind of like table stakes. If I don't feel safe or respected, I don't care about wait times. I'm just not going to go to your facility. So that's, I think that's quite powerful, and we're getting close to, it's out for consultation with Indigenous partners and communities, but we're really looking forward to be able to publish that. So I hope you're hearing a very strong commitment from CIHI on both equity as well as Indigenous health priorities. We really think these are going to be important if we're ever going to be able to tell the story behind the numbers. And so we think these are integral pieces to help people reach their fullest potential. And so my last slide, and I hope you'll see this as a bit of a call to action, is that if I can leave you with 3 ideas to consider. First and foremost is to champion patient voices. So it's a bit of a paradigm shift. I think for many in this room, it's already been painfully aware for you, but see yourselves, patients, as the drivers of change. The importance of convening conversations at summits, very much like this one, now more than ever, mobilizing patient coalitions that elected officials, quite frankly, cannot ignore. And I say that as someone who works for a largely government-funded entity. More importantly, empowering informed choices. People need to advocate to have access to clear, accurate information that you can understand that allows you to make confident decisions about your health or treatment of those you love. Ownership of your health data is too important to leave to the politicians, as I like to say. I think now more than ever, Canadians need to demand this. And then the third thread to this is really about collaboration for change. To me, true change requires a different way of working and a different way of organizing ourselves. True partnership with providers, policymakers, citizens, patient advocates. It doesn't work unless we all come together on this. So this slide refers to a thing called the Healthy Data Collective. This is something CIHI has supported. We don't run it, we don't own it, we're supporting it. And that's a very important distinction. It's a new initiative for us, and it's really dedicated to trying to transform Canada's fragmented health system and its health information system into a more connected, inclusive, and effective network that benefits all Canadians. So we see this as a grassroots movement, and it really does include all stakeholders in the discussion. So we're using what's called a collective impact approach, and some of you may be more familiar with this than I am, but essentially it's a grassroots movement. And so it's patient voices, it's retired hospital administrators who are frustrated that they were unable to address these things, and all points in between. And it just creates a community for people to better understand these things and maybe to find a common voice that insists that we do better on this. So I would encourage all of you to visit this site. CIHI facilitates lots of awareness-raising educational topics around how can sharing data save lives, the importance of data sovereignty, etc. So it's a real great place to get a lot of learning about what's possible, as well as plug into a burgeoning community of voices demanding that we do better as a country on this. One thing I'll highlight for you is a thing called the Canadian Health Data Charter, which speaks to your rights, or what should be your rights when it comes to your health data. So I'd encourage you to look that up. And the website is healthydata.ca. I'm sure it's somewhere in the materials. There it is. So I guess I would just, in closing, thank you for your interest in this. I know data can be very, and I say this as a data guy, it can be very boring, very opaque. I work with a lot of data nerds, and they're great people. But the importance of this transcends being a data scientist. It's actually about empowerment, and hopefully you will support us in that and participate in the data side of these discussions. So with that, I will conclude, and thank you so much for your time and interest.